Hi friends. So I'm already posted a vital signs body temperature mm, in my channel that video, and this is pulse. You see that video, and then after you see this video, because we must understood my topic, how what I am telling about this topic, vital signs topic. So please watch my channel. And now let's go to the our topic is pulse. So pulse is a wave of blood created by the contraction of left ventricles. So pulse reflect the heartbeat and stroke volume, and the compliance of arterial wall are the two important factors influencing heart rate. Okay, so pulse rate is regulated by autonomic nervous system. So already I told you two important factors are there in stroke volume, artery stroke volume. So peripheral pulse and apical pulse. So what is meant by peripheral pulse is a pulse located in the periphery of the body. For example, in our body located area, foot and then neck. And next one is apical pulse. So this is called as a central pulse, and it is located at the apex of the heart, and the pulse rate is expressed in beats and minutes. Then next, the difference between peripheral and apical pulse is called pulse deficit, and it is usually zero. And the difference between peripheral and apical pulse is called pulse deficit, and it is usually called zero. We must remember this one. So many members are confused this. Okay, so next one is pulse is accessed for some rate and rhythm and volume and elasticity of arterial wall. So rate it is nothing but 60 to 100 beats per minute in our pulse rate. Okay, and what is the pulse rhythm? It is a regulatory, sorry, regularity or irregularity. And the next, volume and elasticity of arterial wall, and the pulse is commonly accessed by palpation, feeling and auscultation, hearing using a stethoscope. We should for example, you should check the patient pulse rate. So how you should check uh, your stethoscope, or else fingers, our fingers, okay, hand fingers. So how to check means, you feel the palpation. Okay, palpation and auscultation. You hear what beat is pulse beat is present or not. So you feel. So next one is factors affecting pulse rate. Age and sex. The age pulse rate of an infant ranges from 100 to 160 blood pressure BP. Okay, and the normal range of the pulse is an adult is 6 to 100. And next, sex, gender. After puberty, the average male's pulse rate is lower than the female, okay. And next, autonomic nervous system activity. Stimulation of the parasympathetic nervous system results in decrease in the pulse rate, and Stimulation of sympathetic nervous system results in an increased pulse rate, and sympathetic nervous system activation occurs in response to a variety of stimuli including pain, anxiety, exercise, fever, and ingestion of caffeinated beverages and change in intravascular volume. These are the responses to variety of stimuli. Okay, and next one, exercise. Pulse rate increase with exercise. For example, morning or morning exercise is most important to our body. Why? Because blood pressure increases with the exercise. So this is the exercise, why we exercise. Okay, and low fever increases pulse rate in response to the lowered blood pressure that results from peripheral vasodilation, increased metabolic rate. This is the fever. And then next, heat increases pulse rate as a compensatory mechanisms. Heat also important to the pulse rate. And stress increase the sympathetic nervous stimulation. Stress is increases sympathetic nervous stimulations. Then next, position changes. A sitting or standing position, blood usually pulls in dependent vessels of the venous system. Because of decrease in the venous blood return to heart and subsequent decrease in blood pressure increases heart rate. Okay, this is the position changes. And medication, cardiac medication such as digoxin decrease the heart rate, and medication that decrease intravascular volume such as diuretics may increase pulse rate. And atropine inhibits impulses to the heart from the parasympathetic nervous system, causing increased pu- pulse rate. Okay, and propranolol, and propranolol medication is there. So these propranolol blocks sympathetic nervous system action, resulting in decreased heart rate site used for measuring pulse rate. Okay, and next, carotid, at the side of the neck below tube of the ear, where the carotid artery runs between the trachea and the sternocleidomastoid muscle. So you see the picture here, carotid pulse, how to check. Okay, and next, temporal. The pulse is taken at temporal bone area. And apical, at the apex of the heart, routinely used for infantile children less than 3 years children, and in adults left mid clavicular line under the fourth, fifth, sixth intercostal space. And branchial, at the inner aspects of the biceps muscle of the arm or medially in the antecubital space, elbow creases. Okay, and radial, on the thumb side of the inner aspect of the wrist, readily available and routinely used. And femoral, see the picture here, radial and brachial pulse, how to check. And along femoral, along the inguinal ligament, used for infants and children. And populated behind the knee by flexing the knee slightly. And posterior tibia on the medial surface of the ankle, Pedal dorsal pedis palpated by feeling the dorsum upper surface of foot. Here we see posterior tibial and dorsal pedis pulse. Okay, so what are the points, pulse points? You see the pictures and okay, here superficial temporal artery is there, and carotid and brachial and radial, and here femoral and popliteal and posterior tibial and dorsal PDS. Okay, these are the side points. Yes, sides. And pulse, a wave of blood flow created by a contraction of the heart. Okay, see the pictures and um, understood. Okay, and methods. So pulse is commonly accessed by palpation, feeling. Okay, already I told you how to we feel. How to we feel means we should patient here some sites are there, so sites you should check that sites and you feel it and you hear that, I mean you palpation and you articulate that. So this is the pulse commonly accessed by palpation, feeling and articulation. Okay, and the middle three fingertips are used with moderate pressure for palpation. So how you check? You middle The middle three fingertips are used with moderate pressure for palpation of all pulses except apical and okay. Access the pulses for, so rate and rhythm, volume and elasticity of the arterial valve. These are the axis of the pulses. So you see the picture like this. Okay, and pulse rate. So normal pulse rate is 6 to 100 beats per minute. How do we measure pulse means beats and minutes. Okay, and adults pulse rate is less greater than 100. Blood pressure is called tachycardia, and adult pulse rate less than 60 blood pressure is called bradycardia. Okay, and pulse rhythm. So rhythm, what is a rhythm? So the pattern and interval between the beats, random irregular beats. So dysrhythmia, dysrhythmia. Okay, and pulse volume, the force of blood with each beat. And a normal pulse can be felt with moderate pressure of the fingers, and full of bounding pulse, forceful or full blood volume destroy with difficulty. Weak feeble readily destroy with pressure from the fingertips, and elasticity of the arterial wall. So here I am tell rhythm and volume. Okay, so here elasticity of the arterial wall. A healthy normal artery feels straight, smooth, soft, easily bent, and reflect the status of the client's vascular system. So next, if the pulses is irregular, measures count for 30 seconds and multiply by 2. Okay, and if it is irregularly count for 1 full minute. Okay, and each heartbeat consists of two sounds. S1 means is caused by closure of the mitral and tricuspid valve separating the arteria from the ventricles. Okay, The next one, S2, it is caused by the closure of the plutonic and iodic values. Okay, and the sounds are often described as mufinid, like lub and dub. Okay, S1 is lub and S2 is dub. Okay, so these heartbeat consist of how many types? Two types. Okay, S1 and S2, lub and dub. Okay, so here you check like this pulse rate. Okay, and today this pulse topic is completed. So the next respiration topic, and I, I will send another video in my channel, so please see the video, and if you have any doubts ask me with the help of comments, sorry, with the comments. And thank you all. So subscribe my channel, and see the first body temperature video also. So the next pulse video, because you should understand what I am telling in this vital signs. And so pulse, I think all are more like this pulse topic, because of some curiosity in this pulse topic, because how to check so many questions are raised in this pulse. So thank you, and if you have any doubts ask me, and comment me, and I will tell you the answers, what you questioning me. So subscribe my channel, and thank you, and encouraging me, supporting me. Okay, thank you all. So stay safe and stay home. Thank you.